Observe the obvious. What does that mean? It means exactly what it says. Observe something that's obvious. See it for what it is. Acknowledge it. Don't argue with it. It's there, okay? So we're going to talk about how TMD got sidetracked, misdirected, combobulated, because the dentists who try to treat this, the scientists who try to come up with a solution, the different generalists and specialists refuse to observe the obvious and then follow that obvious direction. That is why for the past 70, actually 90 years, TMJ, which everyone calls a TMJ, of course, everybody has two TMJs, temporomandibular joint disorder, singular, it's not multiple disorders, it's one disorder, which we have discussed many times. TMJ disorder is something that could have been solved 90 years ago if the profession of dentistry had begun to observe the obvious. And I will explain. And hopefully within the next few minutes, it will make sense to you, because my job is to teach and make sense about this problem, conundrum, called TMD. So again, historically, TMD was first noted, identified as some kind of problem by Dr. James Costen in 1934, who was an ENT surgeon out of St. Louis, Missouri, who wrote on this syndrome, who wrote an article on this syndrome of jaw pain and neck pain and headache that he associated with a joint problem, joint damage. And for the next 20 years, that syndrome, which was noted as a TMJ syndrome, was called Costen syndrome. And in the 50s and in the early 60s, it began to have its own nameplate, and it was just called TMJ, which confused everybody because TMJ, temporomandibular joint, is just the name of the joint. It's like going to the orthopedic surgeon and announcing you have knees. But everyone walks into a dentist's office and says, I think I have TMJ. It's humorous, but true, and that solidifies how confused everyone was and is about the problem. To this very day, most dentists, most physicians, most patients, almost all, still call the problem TMJ.